Okay. Hi, my name is Yoojin Kim. I'm a first-year ISM student, and this year I'm studying pediatric emergency medicine. I chose to study pediatric emergency medicine because I really like working with kids, and I wanted to do something that would allow me to help them. And so through ISM, I hope to learn more about this field and gain more experience. The quote I chose was, "Believe and act as if it were impossible to fail." It was said by Charles Kettering, and I really like this quote because it reminds me to be confident even when I can't do something very well, and just fake it till I make it. So I started off ISM not knowing what subspecialty of pediatrics I wanted to be in. So my first interview was with Dr. Gruchala. She is the professor of pediatric allergy and immunology. All of my interviews were with professors at UT Southwestern, and a cool thing about her was that she specialized in pediatrics, but she also worked at Parkland's, which meant that she could see the difference between the treatment of adults and children. And we had our interview in her office, which is really near the lab she was working in, and her main research interest was why cases of allergy have grown among children recently. And she said that this was a worldwide phenomenon, so pediatricians all over the world were trying to figure out why this was the case. And one advice she had for me was to be involved in volunteer work. She said this was really important to get into medical school, and it was important to have experience and tell the people in medical school that you knew kind of what the hospital setting was like. The second interview I had was with Dr. Hennis. He was the Chief Division of Pediatric Emergency Medicine, and because he was the chief, he had a lot of administrative work, which meant he had a lot of meetings and a lot of paperwork to do. And so when he worked in the clinical stuff, he had a variety of cases because children came in with broken bones and different colds and fevers, and so he said that was really different. The third interview was with Dr. Ayana Cohn. She was the chief of child neurology, and within neurology, she specialized in muscle dystrophy, which was the loss of muscle mass and the weakness of muscles. And she said it was important to have empathy when dealing with her job, because she would have to tell parents that their child couldn't walk again, or they would have to be on wheelchairs for the rest of their lives. And so it was important to sympathize with the patients and make them feel understood. The fourth interview I had was with Dr. Norcross. He was the professor of child psychiatry, and a really cool thing about him was that he specialized with kids in foster care, which meant he would deal with their psychological growth and their behavioral growth with the kids in foster care. And so he would prescribe medication and do psychotherapy. And he said that the changes in psychiatry were very incremental, they weren't immediate. The next interview I had was with Dr. Okada. She's actually my mentor, and I met her from a referral by Dr. Hennis. She is the professor of pediatric emergency medicine. And like Dr. Hennis said, she also talked about having no fixed work schedule because the ER is open 24/7. And so sometimes she would have to work all days and get the nights off, and sometimes she would work all night and get the days off, so her days would be flip-flops. And one thing she also said was that the ER is not as glamorous as the TV portrays it. She would get a lot of cases with children having diarrhea or having fevers and colds, and so it's not all about the gory wounds. Important things she said were to have communication skills, because she would have to have effective communication to see what was wrong with the child and treat them effectively. And it was also important to multitask because it gets really busy in the ER room, so she has to do things all at once. And one thing she wished she knew more about was the business of medicine that had to do with healthcare and insurance and billing. And she said, while that wasn't really a part of her job, people still asked her about it, and so she wanted to help them, but she couldn't at the same time. And one thing she said that really left an impact was on me was that children are not little adults, so you can't treat them like little adults. They are, you have to treat them separately, and communication will be a little bit more difficult since they're children, but that was interesting. And then the last interview I had was with Dr. Inanoglu. She is the Associate Professor of Pediatric Physical Medicine and Rehabilitation. Her main job is to restore basic functions such as movement and speaking with children that have disabilities. And she said that the boundaries of this field are not clearly defined because the range is so big between what kind of disabilities they have and what functions they need to restore. She was also really involved in teaching work, so she had a lot of great advice for wanting to go into medical school. One thing she said was really important was to have persistence and competitive nature, because medical school is really long and it gets really hard at times, so you just got to have persistence and go through it all. And a really surprising fact I learned was that there were only 222 pediatricians that were certified in the nation, so she said that there was a greater demand for pediatric physical medicine rehabilitation pediatricians. So on to my research. My first research was a little bit more broad. It was about the challenge of communicating with pediatric patients, and basically it talked about how to communicate effectively with children so that the children felt understood and it had effective diagnosis from the pediatrician. And they also talked about the triad of interaction, which was the interaction between the patient, the pediatrician, and the parent, because sometimes the patient can be a toddler or an infant, and so it's not possible for the pediatrician to communicate with them very well. And so it also said that the patients are influenced by the surroundings of the hospital, such as the smells or the sound, so the environment also plays a role. The second research was about children and allergies. I did this research after I had my interview with Dr. Gruchala, and she said that the allergy cases among children were growing. And the four main triggers that caused allergies were outdoor, indoor, and irritant, and food. And within food, 6 million children in the US have a food allergy. And the tendency to develop allergies are hereditary because there are factors that cause them to be environmental, such as pollutants, but mainly they get passed down from their parents. The third interview was about the causes and inheritances of muscular dystrophy. Again, muscular dystrophy is the weakness and loss of muscle mass, and it happens when a mutated gene fails to produce a functional dystrophin. And it's more common among males than it is in females, because females have an extra X chromosome that can cover up the mutated X chromosome. And so the picture above shows how it is passed down through their parents, and the second picture shows that the people with muscular dystrophy have a much smaller muscle mass than people that do not have muscular dystrophy. The fourth research I did was about delivering bad news to parents of pediatric patients, and this was really important, especially in the neurology field, because these pediatricians would have to tell patients and parents that their child did have a chronic illness or disease. So it was really important to empathize with them and sympathize and tell them that they understood what they were going through. And so the main thing about this one was that a physician's communication skills play a role in how families cope with the news. So how pediatricians decide to relay the information can really make an impact on how the family decides to accept the news. And so it told pediatricians to be upfront and honest no matter how bad the news may be. And so after ISM, I plan to go to either UT Austin or A&M. And my ultimate goal is to get into medical school and become a successful pediatrician and just do what I really like doing. So that's the end of my speech. Thank you.